You know what? I haven't even thought about the prize money as a factor. I'm still kind of in awe about the Manning Innovation Award itself and just the principle behind it.
As a successful drug company representative, Bill Adams had issues with the age-old practice of giving out samples at doctors' offices. He wondered how the samples fared in the back of his car during hot or cold weather. He wondered how drug samples might clash with other meds the patient is taking unbeknownst to their doctor. He wondered about theft and how expired drug samples are disposed of. This is Bill's solution. The Smart Sample Card represents the drug, which when signed by the doctor becomes a prescription, which is then safely checked and dispensed from fresh stock by the pharmacist, all at no cost to the patient. Bill Adams, recipient of a $10,000 Manning Innovation Award.
The traditional sample comes in a different packaging. It's basically medication in a pre-packaged container, usually small quantities, 5, 10, 12 pills. A smart sample is that same quantity of medication, but it's a paper-based vehicle that the physician would open up when they see the patient, write the patient's name, write their name and address and their information, sign it and date it. This now becomes a prescription for that sample medication that was traditionally in their office.
Well, traditional drug sampling has had a lot of problems. For one, storing is an issue. Oftentimes they sit in your drawers or shelves for a long, long time, and efficacy becomes an issue. And I think for me, the most important one is when I hand that to a patient, I might have done a cursory drug interaction check or sometimes not. And I'm never certain if they will sort of go to a pharmacist, ask them to check it or not. So drug safety and efficacy has always been a concern.
I'm a pharmacist, and when a patient presents the smart card to me, I immediately enter it into the computer, put it on their profile, and now I have a history of what medication completely that they're taking.
You know, I think Bill Adams was a visionary because in retrospect, he had a green solution to the waste that's generated from drug sampling.
If you look at a sample, you'll see often that it's blister packed in aluminum, it is sealed with plastic over that, we've got then a cardboard box, and all of a sudden you open it up and you think there's 5 pills in there, there's only 2.
The nice thing is it's paper-based, so if it is not used, it's not a major environmental issue.
We are looking at a green solution that is Canadian-made, which also is probably the most safe way by which doctors can give patients drug samples.
The benefits for the pharmaceutical company are basically a more efficient method to get samples to their representatives, a savings in distribution costs, a savings in storage cost, an improvement in patient safety, a model that has no waste. To a physician, Smart Sample saves time. All the physician has to do is pick a Smart Sample up, sign it to the patient, authorize it, then it becomes a prescription for that sample product.
Now, for our valued patients, we know exactly everything that they're on. We know everything from A to Z, and we know that if there's any drug interactions, we can identify them and why they're happening.
I can tell you in a doctor's world, and when it comes to safety, it is perhaps the most valuable thing that they could have done.
December 22nd, 2002, that was our first transaction. That was our eureka moment because, you know, everything worked as we thought it would work in the system. And we've grown from basically one transaction to thousands of transactions a day. It's awesome.